So, with it being Disability Pride Month, I want today to look at cerebral palsy. Cerebral palsy is a lifelong neurological condition and it's caused by abnormal brain development or injury to the developing brain, which usually happens before birth. It affects movement, muscle tone, balance, and posture, and is the most common motor disability in childhood. Cerebral palsy is a group of disorders and not a single disease. Cerebral palsy originates in the brain, and the palsy refers to muscle weakness or movement difficulties. It doesn't worsen over time, although symptoms can change as the child grows. CP happens when the developing brain is damaged or doesn't form normally. As I said, this usually happens before birth. It can be genetic changes, maternal infections, such as CMV, rubella, toxoplasmosis, there could be a stroke in the womb, bleeding in the fetal brain. During birth, it could be a lack of oxygen, which is less common than once believed, or complicated or prolonged labor. After birth, it could be meningitis or encephalitis, head injury, or severe jaundice. Symptoms vary widely. Some children have mild difficulties, while others have significant physical or developmental challenges. It could be something like movement and muscle tone, such as spasticity, which is stiff muscles or tightness, floppiness, like in low muscle tone, poor balance or coordination, tremors or jerky movements, slow writhing movements. Some developmental signs are delayed sitting, crawling, or walking, favoring one side of the body, difficulty with fine motor skills. Speech and eating, such as trouble sucking, chewing, swallowing, drooling, speech delays. Other possible symptoms are seizures, vision or hearing problems, intellectual disability, although not always, and behavioral or emotional challenges. Doctors classify CP by movement pattern and by which body parts are affected, such as movement types. Spastic CP, which is stiff muscles, which is the most common, usually about 80%. Dyskinetic CP, uncontrollable movements. Ataxic CP, balance and coordination problems. Mixed CP, combination of symptoms. And body distributions, such as hemiplegic, one side of the body, diplegic, legs more affected than arms, and quadriplegic, which is all four limbs. It's diagnosed between the ages of 1 to 2 years old, though high-risk infants may be diagnosed earlier. Doctors use developmental screening, neurological exams, and MRI to identify brain injury or malformation. The body symptoms that are usually affected are vision, hearing, speech, bladder, bowel, sleep, breathing, orthopedic issues like hip dislocation, scoliosis. But other systems can also be involved. There is no cure for CP, but early intervention dramatically improves outcomes. Usually they use physical therapy to help, occupational therapy, speech therapy, and family-centered developmental therapy. They also use medications such as anti-seizure medications, muscle relaxants such as baclofen, botulinum toxin, and pain management. Sometimes they will also use surgery to help treat, such as in tendon release, orthopedic corrections, such as hips and spine, and a baclofen pump. Also, assistive supports such as braces, walkers, wheelchairs, and communication devices. The prognosis and life expectancy for people with CP is lifelong, but it's not progressive. Many people with CP live into adulthood, and usually walking abilities by age 3 to 9 is a strong predictor of long-term mobility. If you want to learn more about this particular disability, I would encourage you to research and look into it more. And happy Disability Pride Month to all of my friends like myself that are disabled. Take care, and I will see you next time. God bless. Bye-bye.